Shipping control.
Hi, sir.
Maayong adlaw Negros kag Bacolod. Yari naman kami para magadulong sa inyo sa isa ka special feature diri lamang sa The CLMMRH Insider. Wala pa ang COVID pandemic pero may isa na ka grupo sa CLMMRH nga nagasabat kag nagabulig kung may mga disaster o kon emerhensya. Mas naging kitaon pagid ang ila presensya sa ospital sa pagsugod sa pandemya duwa ka tuig na ang naglikad. Sa subong nga episode aton kilalahon ang Health Emergency Management Bureau sang CLMMRH. Paano bala natukod ang HEMB sa CLMMRH kag sino ang mga katapos sini?
HEMB started as the Stop Death program of the DOH. This is born out of the Administrative Order number 6B of 1999, institutionalizing Health Emergency Preparedness Response Program of the DOH. On 2004, another administrative order was created. This is the DOH Administrative Order number 168 of 2004, wherein a national policy for health emergency management staff was created. And on 2017, it was renamed as Health Emergency Management Bureau. The HEMB, as we call it, is composed of volunteers coming from the nursing service, mostly coming from the nursing service, and the medical division. These volunteers dedicate their time in training as well as training other personnel in the hospital.
Ano ang mga responsibilidad sang grupo sa ospital kag sa komunidad bago ang pandemya?
HEMB is tasked to respond to any types of disasters. So we are sometimes called to help out other health institutions in the province as well as all throughout the Philippines whenever a disaster strikes. Before the pandemic, HEMB is tasked to educate our fellow healthcare workers in training for basic life support, standard first aid, lifting and moving, and fire brigade enhancement program. We are also responsible for educating them on fire as well as earthquake and perform drills during the month of March and July.
Sa subong nga yari na kita sa pandemya, ano ang naging kontribusyon sang HEMB?
During the pandemic, the Health Emergency Management Bureau was tasked to open the Operation Center of CLMMRH, wherein we do traffic on the inter as well as intra-facility transfers. We also communicate with the different LGUs as well as the CTEOC for the transport of patients coming and going out of the hospital. Aside from the inter-facility transfers, we also facilitate our healthcare workers in their hospital-supervised home isolation, which was granted by the City of Bacolod. We also take charge of training the healthcare workers in their donning and doffing of their PPE. This is in cooperation with the ICC. Also, the HEMB was given the chance to manage the healthcare workers, their rotation at the COVID area, which is the West Tower building, Mother and Child building, as well as the CCU. We have recently cascaded our disaster risk reduction management for hospital plan to the healthcare workers and reorient them in their response to fire and earthquake disasters. We are planning to hold a drill on the second week of February and during the fire month as well as the disaster month in March and July respectively. I would like to remind everybody to follow the existing health protocols as well as those lectures that were given to you by your HEMB personnel so that you can properly respond to any emergency or disaster that will happen in your unit.
Kami sa CLMMRH saludugid sa mga katapos ng Health Emergency Management Bureau. Wala nagaisip sang oras, kag wala nagapanumdum sang risgo sa ila kabuhi para lamang makadulong sang serbisyo sa mga pasyente sang CLMMRH kag sa mga pumuluyo sang Negros. Ano balang balatyagon nga maging katapo sang HEMB?
Hi, ako si Julie Gamuyao. Ako ang Assistant HEMB Manager sa CLMMRH HEMB. So, since 2008, nagsugod ako sa HEMB until today. So, it's been 14 years nga rin today. And I'm very happy nga na-train ako sa madamo gid kaayo nga trainings like the basic life support, standard first aid, mga fire brigade, EMT. So it's a special nga mga trainings nga skill, physical and skilled nga mga trainings. So very happy kami nga although na-train kami sa Amosina, we were also trained nga maka-train kami sa iba. Naka-impart kami kung ano na to ang natudlo sa amo, na-impart naman sa iba namon diri na upod. Hindi lang diri sa hospital, upod hasta pagid sa mga different places diri sa Negros Occidental. So sa ini nga pag-train naman sa ibang nga tao, dira kami nakakita satisfaction nga paano kami nakatudlo sa iba nga naka-learn sila in cases nga may mga incidents or accidents or disasters. So makabalo sila kung anong ilang nga pagabuhaton. Sa ina pala nga sistema heartwarming gid sa amon nga Corazon nga daw nalipay kami nga may nabulig dili kami sama ni sa katao. So after sini mga pila na lang ka years ma-retire na ko. So happy gid ko nga ibilin ko sa ilang legacy nga amo na galing nga katudlo ni sa iba nga pod na hospital.
Bago kita magtakop, ang CLMMRH nagabaton lamang sa subong sang coordinated referrals. Para hindi mabudlayan ang aton mga pasyente, yari ang mga hospital hotline para sa coordinated transfers. Para sa mga nagakalatabo diri sa CLMMRH, like and follow us sa Facebook, Instagram kag YouTube. Mga kasimanwa, padayon kita nga maghalong kag magobserbar sa mga health protocol kag magbato na sa bakuna batok sa COVID-19 ilabi na gid sa subong nga tiempo. Kita ay kitaliwat sa masunod nga episode. Sa liwat, buligi kami sa gihapon nga maserbisyuhan namon kamo sang maayo. Ini si Wilindi Hiponea para sa The CLMMRH Insider by Horizon.